My name is Grace Dyke. I work for Alzheimer's Society and my role is to set up Dementia Action Alliances across the North West. So I've been helping Salford to set up a Dementia Action Alliance.
Dementia affects over 750,000 people in the UK. It is not a disease in its own right, and it is not a natural part of ageing. It is an umbrella term that describes a group of symptoms that are caused by many diseases that affect the brain.
I think it's a great job. Love it, I have to say.
Salford Dementia Action Alliance is lucky to have over 30 members, and what's special is that they recognise that if we want to make our community more dementia friendly, it needs to be everybody's responsibility, not just that of health and social care. So we've got all sectors represented on the Salford Dementia Action Alliance. We've got transport in the form of Manchester Community Transport and the private hired taxi firm Mainline 7's Taxis. We've got education with Salford University on board. We've got leisure in terms of Salford Art Museum and also the Lowry Theatre, as well as the CCG, which is the Clinical Commissioning Group, the hospital and various voluntary organisations.
Hi, yes, I'm Maggie Pearson. I'm Pro Vice Chancellor for Public Benefit across the University of Salford, and I'm Dean of the College of Health and Social Care. Well, the university is a member of the Salford Dementia Action Alliance, so that means that we have an action plan of what we're going to do to become a dementia-friendly university, and we need to commit to implementing that. But I'm also, myself, Chair of the Salford Dementia Action Alliance, which we launched at Media City on November the 11th.
My name's Jean Mann. I'm the manager for Age UK Salford's Dementia Support Services.
And I'm Mary Ann Byrne. I'm the team leader for Age UK Salford's Dementia Support Service.
Our organisation was approached and asked would we sign up to the Dementia Action Alliance via Grace Dyke. So we signed up, and obviously because we're already providing dementia support services anyway, the action points that I devised weren't the same as some of the organisations in the community. So our staff training, that's already done, so we didn't have things like that, but we decided that we'd be more involved in raising awareness of dementia throughout the community and also raising awareness of the service that we provide.
My name is Jamal and I volunteer here for 2 years, 2 hours on Thursdays, and I feel very happy.
Well, I'm responsible for the community groups that we have for people living with dementia. We have, let me think, how many have we got now? We've got 4. They're specifically aimed, like I say, at people with dementia. Carers, we have a separate group for carers, which is on one Thursday a month. The main purpose of the groups are for people to socialise, do cognitive activities. We do things like quizzes, reminiscence, things like that. We also do physical activities, you know, keep people healthy. It's a good opportunity for carers to have some respite, so they get a bit of a break from looking after the person that they're caring for, and also it's a bit of independence for those that have got dementia. You know, it's nice to be away from the carer on occasion so they can look after themselves.
I'm Betty and I'm a carer for my husband Norman. Hurt my husband more than anything when he was told to give his licence up. He broke his heart because he'd been a long distance lorry driver for years and years and years, and to lose it just like that, he blamed me. And he still blames me, I think. I've got his licence, I've hid it. But it was the doctors told me he had to, so what he told, it's help that you're given, and you do what they tell you.
I'm Rose, I'm a carer for my dad. It was amazing. From within a week from that first phone call, somebody came and assessed my father in his own home, told us all the things that were going on, and we've never looked back.
I'm Linda. I care for my mum, Sue. There was just something, I knew it wasn't quite right with her, and I made an appointment for the doctor, and then he sent me to Woodlands, and then a scan, and then they sent a nurse round to the house, and she told us all about these things. And the first place they suggested, we took my mum there, and she didn't like it at all. She thought she was going to have to stay there, and we were so amazed when she came here. She just took to it and really enjoys it.
Family carers of people with dementia save the UK over $6 billion a year. The proportion of people with dementia doubles for every 5-year age group.
I work for Console Homes, part of the independent living team. I specialise in providing services to keep people independent in their own home. It gives me such a lot of satisfaction to actually see the difference you're making. You get people that you meet all the time and you can see they're struggling, what they're doing and everything. It's quite nice to actually visit somebody and see, you know, the small things that you put in place. It's helped them to stay independent and they're still here, still part of the scheme and part of the community, and that you've made a difference. It's really good.
We have over 30 members already of Salford Dementia Action Alliance, and that's an outstanding achievement, but there's still more we can do. So for any organisation watching this, please do get in contact with me at 01925 572 239 or visit www.dementiaaction.org.uk to see how you can be a part of Salford Dementia Action Alliance.